this has been a key issue up here on Capitol Hill. It's the reason that the government shut down for 6 weeks, because Democrats said they would not vote to fund the government if they did not vote to continue the subsidies that go to 24 million Americans who sign up for their health insurance on the marketplace, commonly known as Obamacare. Well, eventually a handful of Democrats said they would fund the government if a vote takes place on the subsidies. That is what happened here today. And that vote failed. The Republican plan, that failed as well. So now the question, what's going to happen? A lot of these 24 million people say they simply cannot afford this health insurance without the subsidies, because their premiums, even with the subsidies, were already going to go up 26%. There are some that say this is going to raise the cost for health insurance for every American. That is the question I put to the Republican Senate leader, John Thune.
It's not going to increase premiums in the marketplace for most people who get their insurance. About 150 million Americans get theirs in the group marketplace, the employer-provided insurance. Another 140 million are on Medicare and Medicaid. And then you've got this about 6 to 7% of the people, 23 to 24 million Americans who get their insurance in the individual marketplace, most of whom are going to continue to be covered, because the 400% and poverty level and under is the base Obamacare program, which continues.
The Republican Party set out to devastate health care in America in two ways. One, by not stabilizing the Affordable Care Act, and two, through their big, beautiful bill, taking over $1 trillion out of Medicaid. So next year, both at the beginning and the end, you're going to see tens of millions of Americans lose health care, and they're doing nothing about it. They talk about trying to help everyday Americans afford the basics, but what they're about to do is to send millions and millions of Americans into financial catastrophe, where they're going to have to choose between paying the rent or making the mortgage and affording health care.
And time is running out for these Americans, because under the law, there's a set period of time where they can sign up for this insurance, and then it's locked down. So that deadline, December 15th, so just 4 days from now, to decide if they can afford to pay for this health insurance without government help. Patty Culhane, Al Jazeera at the Capitol.
Now, Lindsay Allen joins us live from Chicago, Illinois. She's a professor and health economist at the Feinberg School of Medicine at Northwestern University. Welcome to the show. The numbers, the politics of all of this are mind-boggling. We've unpacked it there, but let's take a look with you about the actual healthcare impact that this will have on America. This is if millions of people lose their health insurance. 23 to 24 million people might not be able to afford health insurance. That's going to have an impact across America, right?
Absolutely. So when we lose insurance as Americans, we don't stop needing care. Instead, we just wait longer to get it. And so conditions get worse. And when we do finally seek care, it's often in the emergency department or in the hospital, which is the most expensive setting where you can get care in the United States. So the care still happens, but it costs more and outcomes are worse. And ultimately, taxpayers have to pick up the bill.
Now, Lindsay, you've got a very interesting title. You're a health economist. It's the first time I've kind of heard of that title. It seems to be a very uniquely American thing, because you have this kind of public-private healthcare system. So for me, the fact that you are a specialist in an area that the rest of the world seems to have pretty much worked out as welfare, not charity, is interesting. Why is this such a lightning rod issue?
So the issue right now that we're seeing happening in Congress all goes back to how we in the United States view healthcare in the first place. And we're divided on whether we view healthcare as a product that can be traded in a market like other products, like a smartphone, for example, or whether healthcare is a human right. And if you look at it as a human right, then the support for healthcare should be coming from the government. If you view it as a product to be traded on a market, then it's something that people should shop for, and you only get it if you can afford it.
But Lindsay, that leads to what you just said, which is very interesting. It leads to a marketplace. With marketplaces, you get middle vendors, you get people who are just simply middlemen. Insurance companies are making a lot of money here. There's a lot of money being made by private companies to give public health care. That has an impact, surely, on how healthy Americans can be, given that they won't go to hospital if it's going to cost them anything.
Absolutely. So there is a saying that might also be uniquely American, which is health is wealth and vice versa. And so when Americans are lower income, they are less likely to get good health insurance and get their health care, which in turn means they're less able to participate in a marketplace and in the job market. And so one of the things that we really want to think of when we're thinking of health insurance and Medicaid and Medicare is as a economic driver. So these are programs and plans that allow people to maintain their health, and then they can be members of the job market and go on to pay taxes and all those things that we also love as Americans.
Lindsay, you're a public health professional. I'm just going to ask you a very simple question. Is this a good system?
It is not a good system, but I will say that it is we have the exact results in our healthcare that we have designed. So the system is broken, and the United States healthcare system kind of created itself in very incremental ways. And so we've been trying to patch it up ever since the inception of things like Medicaid and Medicare. And so this is just going to be another patch in this terrible quilt that we've been weaving so far.
So not only an impact on health, but an impact on politics as well. Lindsay, thank you so much for joining us.
Thank you.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.